So we're going to go over some of the hardware that came with your units. The first one is this patient safety switch. So this is going to plug into the back of the unit, and I will show you where that goes in. It's a simple USB port that plugs in right next to the power switch. You also have a remote control. This is going to be helpful when you have therapists that you'd like to, or patients that you would like to use muscle stimulation during a functional task. And I'll go over one of the protocols for that and how to implement that, that protocol. You also should have received a pair of gray lead wires. These are going to be your single lead wires, and they're going to be the ones that you primarily will be utilizing. Okay, and then you have the bifurcated cables, and I've laid one out. You'll have a green and a blue for each of these sets. I laid one out here just to demonstrate that these are basically splitter cables. It's going to allow you to have 2 A channels and 2 B channels. So this is particularly helpful if you're going to be doing a bilateral treatment for ISC, let's say, for a patient who has bilateral knee pain, or maybe bilateral shoulder pain. It also can be very helpful to do both extremities with the patterned E-stem protocol as well. The last cord that you should have had, if you did get the ultrasound with your unit, is this single black cord with the red tips, and that one's going to be used for the combination therapy. So that's when we're doing E-stem and ultrasound together. And the last thing here is going to be your ultrasound head, which attaches into the unit if you did receive that. Okay, so I'm going to move on to the unit. Kelly? Thank you. So here we have your OmniVersa unit. So I wanted to point out a couple of things on here. On the very top, you have the power switch that will turn on the unit. You also have a power switch that's located down towards the base of the unit. It's a toggle switch that will turn the unit on and off from receiving power from the wall. So when I turn that toggle switch off, I'd like you to notice that there is an orange light that appeared here, and that means that that we are receiving no power from the wall, that it's operating only on battery. When I switch that toggle switch on, that means that we are going to be receiving power from the wall. So when it's green like that, you're getting wall power. When it's orange, you're using battery power. And when I close in on the screen, you'll be able to see a little bit clearer that there's a little battery icon here similar to your iPhones, and that will demonstrate the lightning bolt if you're receiving wall power, and then the fullness of the battery if you are on battery power. Okay. If you are going to be using one of the remote controls or the patient safety switch, that is going to plug in right at the top of the unit next to the orange power switch. Okay, so it's just going to plug in just like that. One thing I also wanted to point out at the front end of the unit before we close in is this is where your A and B channels are going to plug in. So I have your gray lead wires in currently, and they do have the tips that display the red versus the black, and you're going to plug those in accordingly. You also have choices C and D, and those are going to be for your ultrasound, and I have my ultrasound head plugged into port D here. Okay. Let's zoom in here for a sec, get you a little bit closer. Okay, so when we go through the button pushing of the unit, this is your home screen, and so we have 4 choices here. 3 of them are going to be our individual protocols, and then we have the system settings. I would like to go through a couple of things on here that would be helpful to know. If you go into system settings, you will see some opportunity to play with the screen brightness and some of the sounds that display when there's end of treatment, etc. I want you to note here that there's 1 of 2 pages. So whenever there's multiple pages to navigate through, your dial at the bottom will light up, and that's your indicator that you can switch pages by rotating it clockwise. So now I'm on page 2 of my system settings. I'm going to click on the maintenance button here, and that's going to open us up to some opportunities that you guys have to somewhat calibrate or check in on the unit. You do have the ability to optimize the ultrasound head. I'm not going to do that for time purposes today, but I would, since I'm plugged into applicator D, would press that button and it's going to just do a check to make sure that the ultrasound head is operating optimally. When I go to the second page here, this is a very important page to know, is your lead wire test. Sometimes we do have situations where the lead wires get shorts in them, and so it is important to be able to check on that. So if your patient is not feeling the E-stem and you've tried to troubleshoot with, changing position, changing pads, making sure good skin prep was done, you certainly can double check on the lead wires. And so the instructions do a nice job of walking you through, but essentially what you're going to do is, I have one ready to go here. So you take two of the electrodes and you're going to marry them together. So I've taken them and put them gel to gel, okay? And I'm plugged into A, and so when I hit start, it's going to either pass or fail that particular lead wire. So, and I like to kind of jiggle around here to make sure that it doesn't flicker into the fail spot. So I don't have anything plugged into channel B, and therefore that's failing here on me now. So that is an important way that you can troubleshoot. And if you do need new lead wires, you can reach out to your consultant or call the customer support line as well. And go back to the home screen here. And so as I pointed out earlier, you can see a little bit better the battery icon up here in the corner. I'm going to go into electrotherapy first. Okay. And so again, I want you to note that there's actually 3 pages of information here. So these are going to be all the FDA approved indications for use. Okay, so if I scroll to the next page, we're going to see a number of other types of indications and protocols, and then there's actually just one on the final page. So if I scroll back to my first page, there are 3 different options for pain. Okay, so we're going to, if I go into acute pain as an example, it's going to narrow down my choices that would be most representative of when we would want to use the acute pain options. And those are going to be more of your sensory-based E-stem options. And so I have an IFC pre-mod, a TENS, LVPC sensory, and then another choice for IFC, which is a mixed sensory motor, and then sensory nerve block. Once I get into a choice that I've selected, I may run into the screen that says A, B, or A plus B, and it's asking us whether we want to use 2 channels or just 1, okay? So I'm going to choose just 1 channel, and we're going to, once you get to the parameter screen, you just want to make sure you double check that that's actually the protocol that you're wanting to use. And if you do need some guidance on some placements, you can go into this little information icon here, and you can scroll through the 18 pages of possible treatment placements for your electrodes. So always when you go into this information icon, you're going to see a couple pages of a narrative that kind of explains what you're going to be, what you've chosen, how it can help with your patient, maybe some information on how to set them up as well. I'm just going to rotate my dial counterclockwise to pull up some of the pictures here. So this is a nice picture library to give you some ideas. I'll show you if I flip through several of them. Here's an example of our bifurcated cable. There we go. And you can see that it gives you, you'd be using the black bifurcated leads for this type of intervention. Okay, so you have lots of different options. It's certainly not an all-inclusive picture library, but it does give you a lot of great ideas for clinical interventions that you could use. You can hit the back arrow up here at the top to get back to your parameter screen. And now we're ready to set up our patient. So when my indicator is orange, that means it's ready to increase intensity. So I can go ahead and take that and rotate it clockwise until I get the desired response. So I'm in a sensory mode, so I'm looking for a high, a sensory feeling that's strong but tolerable for the patient. Once that is received, I'm going to go ahead and hit start, and that is going to activate the timer. Okay? If a parameter on this screen is modifiable, you will be able to press it and it'll turn white and allow you to change for example, the time here on this one, okay? And then if it is not adjustable, you will hear a beeping sound, okay? So some of the parameters are adjustable and others are not. This depends on which protocol you're in, okay? So if I go back out, and let's say that I have channel A being occupied, so I'm just going to pretend that I've got something going on there. So channel A is occupied, and I go back and I'm a therapist that wants to utilize channel B or wants to utilize the ultrasound. You can actually do two treatments, two different types of treatments on two different patients at the same time. So as an example, if I wanted to go in and do a different type of pain protocol for one of my patients, maybe it's a chronic pain protocol, and I want to do maybe LVPC on that patient, I can go in, and you'll notice I bypassed the screen that asked me which channels I wanted to use. And that's because channel A is already occupied, so it's forcing me to use channel B. So you'll notice channel B is set up in the middle, and I can increase that to the desired effect that I'm looking for. So this one would be a nice pulsing sensation, a tapping sensation, up to a little bit of a motor twitch, and I can hit start. So now I'm operating two different protocols at the same time. And I can toggle back and forth between those two protocols by simply pressing on a channel. I can get back to my sensory stimulation here. If I need to adjust the parameters, just hit that feature again to make it orange, and I can adjust it down or up. And let's say that my second patient, I need to make an adjustment as well. So I click back over by touching that B channel placement, make it orange, and then I can make my adjustment there. It may be hard to see, but the whited out protocol that is running, you are able to see in a really light gray the time and the intensity that is listed there. So you'll be able to notice whether how far along you are in the treatment. Okay. Go ahead and stop that one. I do want to get into the neuromuscular reeducation option. So this is going to be where you're going to find your pattern eSIM protocols. But before we get in there, I do want you to note there's a little orange symbol up here in the corner. And that does mean that there is a program that is running on the unit right now. So right now we don't want any other programs running. So this is kind of an emergency stop switch. So if I press that icon, it's going to actually stop any program that's running on that unit. So another safety feature for you. You'll also find that you need to clear out all the programs if you didn't realize that a program was still running, or perhaps you thought you had exited out of that particular protocol and you hadn't, and it's not letting you get into a different protocol. So just double check to make sure that all those protocols are clear before it will let you move on to another protocol. So in the neuromuscular eSTEM, we've got several choices here. So if I just am going to click on the one for lower extremity triphasic, you'll notice again it did bypass that A-B channel selection, and that's because the PENS protocols do require both channels to be used properly. So A channel always goes on your agonist, B channel goes on your antagonist, and we're reinforcing that proper firing pattern to those opposing muscle groups. So with this protocol, you can, I wanted to show that you can increase both channels together by tapping them both. In all likelihood, you will have to eventually hone in on one channel over the other because they are not likely going to be elicit the twitch at the same intensity. When I hit start, that would be again engaging that time to go off. You do have the opportunity to modify one of the parameters in this protocol, and that's going to be the phase duration. And sometimes we do this if we're not getting enough, we're not getting a twitch at really high intensity. So with that max recommended output list that I gave you earlier, for the 2x2s for this particular protocol, the max is going to be 80. And so if you've reached that 80 and you're not getting the sensation or you're not getting the twitch, this phase duration can be a parameter that you can adjust as a part of your troubleshooting techniques to see if you can elicit that twitch. And I don't know if you noticed that when I hit pause, I'm going to actually increase and show you for a second. So if I have this running and I want to hit pause, the pause button will stop the intensity, so your intensities will go down, but it keeps your time, okay? If I wanted to restart this, I would have to go back and adjust my intensities back up, okay? So it won't remember what the intensities were, and it probably wouldn't be safe to just automatically ramp up to those same intensities anyway. So you will have to go back and dial up those intensities again. But your time does keep, and that's going to be what the pause feature is going to be used for. Okay, so I'm actually going to clear out this protocol by pressing the orange button again. I do want to also point out that there is a save feature here. So if you notice, this little icon here is a floppy disk, a universal symbol of save. And if I press this, I'm able to enter in a program name, maybe a facility, or I'm sorry, a patient's name, a room number. You can type in the amount of days that you want. So let's just say I want to use this on Sam Walker. I can do an SW, okay? And then if I hit OK, it's going to save as SW, okay? So now if I were to go back home, I didn't point this out before, but when I go into the electrotherapy option, I have 3 different menus here. So I have indications, manual mode, and favorites. Okay. We also, under each of the menus, are going to have the contraindications, which will give you a brief idea of what the contraindications are. But again, for a more detailed explanation, you can find that in your reference guide. But you'll notice that you do have a favorites option. So if I were to go to the favorites under electrotherapy, you'll notice my SW that I saved is located there. And I just wanted to show you that you do have a number of ways that you could enter it. This one is very detailed, giving MS is getting 5 times a week, bicep, tricep, alternating with forearm flexors, extensors. So it can be a great way to communicate between your therapist on the protocol that you want to engage in, and it can really help with consistency of application of the proper protocols, as well as the frequency. Frequency is important for a lot of our protocols to have optimal outcomes, so you want to make sure that you're doing them not just PRN or not just once a week, twice a week. They do need to be done on a fairly consistent basis for the most part. So you can kind of enter these in any way you want. So you can see I have a wound daily one, total knee replacement, so diagnosis-based, patient-based, etc. If you do want to delete any of these, you're going to hit the trash can first, and then you can go in and delete, like so. Okay. All right, so I'm going to go back. And since I forgot to touch upon this earlier, the manual mode is simply going to bring you to a menu that narrows down or has you select the waveform. So if you're pretty savvy with the eSTEM, you can certainly go to this. You can modify most all the parameters within this section, but you will not have the option for the protocol pictures and descriptions. So most of the time we are recommending therapists to go in under the indications menu. Okay. The muscle disuse atrophy, I'm going to quickly show you this. This is where you're going to do a Russian style eSTEM, perhaps, where you have on-off cycling times. We have 3 different waveforms here. Just going to pick the one to show you where those parameters are adjustable. You can adjust the channel timing here with the ramp up or ramp down time, as well as the on and off cycling time. Okay. When you ramp up and hit start, it starts in the on phase, you hear that beep, and then it's going to go through that rest phase. And during that on cycle, you do want that patient to get a nice strong isometric contraction in order to really optimize the use of this particular protocol. That's there. I'm going to go back out. And I'm going to go to the second page because I do want to show you where that remote control comes in handy. So when I plug in the remote control in the top, and this will be like we're going to do a Russian style manual on-off cycling. So I'm going to acknowledge that my remote is connected. If I go into the functional re-ed menu, I'm going to choose my medium muscle maybe, or my MFAC would be a large muscle. It says hand control, and that's what that means with this particular remote control. So now I have the opportunity to determine my on-off phase. The channel timing in here is going to be only to adjust the ramp time, which you may need to do if you need a quicker activation of that muscle. For example, if you're going to do an anterior tib during gait, you need that e-stim to go on right away. But if you're doing it with a functional transfer as an example, maybe on bilateral quads, that ramp up time and ramp down time is very appropriate. So what I like to do with this one is go ahead and increase my intensities, get it to that nice strong contraction, or even a sensory stimulation can be beneficial. And then I go ahead and shift over to start the program onto my remote. So I'm going to hit start. You'll see my intensity goes up. And then when I release it, that intensity goes down. So now I'm going to ask, Mr. Jones, let's say, we're going to go ahead and stand up. So we're going to, he starts and initiates that program. I'm going to press this to kind of help reinforce the quad activation during that transfer. And then I'll release it when he's done. So you are controlling the on-off cycling of that one. So that one's a really good functional re-education protocol. Okay. So that's kind of how you get into a lot of the programs. I give you a little tidbit of some practical information with some of our more popular protocols. There are a lot of other ones on there, so definitely reach out to your CPC for guidance on any of the other programs for e-stim that you see in there. We're going to go ahead and move on to the ultrasound if there's no questions, Kelly. Move on along. Okay, so when we get into the ultrasound menu, you'll notice it is the same submenu with indications, manual mode, and favorites. Again, I would recommend going into the indications mode if you can. Manual mode will give you the opportunity to change more of the parameters, but the indications does offer you those FDA-approved indications for use. So we've got pain management, increased circulation, muscle tone and spasm, and decreased joint stiffness, contractures. If I go in under pain, as an example, we've got several options. We've got a more acute pain, subacute, and chronic. And let's say I want to do acute pain. Usually with acute pain, acute situations, we're going to be using a subthermal application. So that's what the protocol is when we get into that one. And I know this because I have 20% listed here as my duty factor. So that means only 20% of the time that energy is being delivered, so not enough energy is being delivered into the tissue to create heat. Okay? I do have an opportunity to adjust my depth, the 1 versus 3. Okay? It does default to 3, which is the more shallow. I do have the opportunity to change the phase duration as well, but 20% is the more common one that's utilized. So that's the default. And 15 minutes is here as the default time, and that's actually indicating 3 separate treatment areas. So 5 minutes per 2 sides of the sound head is actually the appropriate time and area to be focusing your ultrasound treatments. So this is actually giving us 3 areas. So if you needed only a small area, you can adjust that down to the 5 minutes and go from there. Okay? Your ultrasound intensities are in this far right-hand bottom corner here. So I click on that, it's going to give me the ability to increase my intensity, and then I would hit start. And my timer would start, and I would proceed with my treatment. You, again, have the ability to save protocols up here as well. If I were to go into more of a subacute or chronic condition, that's going to be more indicative for a thermal application. So if I go into chronic as an example, you can notice here that it says 2. And so when I tap on this option, I can change from 1, 2 to 4. And the unique property of the ultrasound here is that ACP's equipment has something called delta T technology. And essentially, we've done the calculations for you based on the quality of the crystals in the head and the power and intensity of the unit to know how much time you need in order to get to a certain temperature amount. So as an example, if I were to stay here on this 2 setting, okay, you'll notice I cannot change my time because the machine is going to calculate that time out for me based on my intensity. So when I increase my intensity, watch that time, it's going to go down, okay? So at 0.65 or 0.6 and 3 megahertz is my depth, it's only going to take me 5 minutes and 13 seconds to get to 2 degrees of temperature rise. So that's what that 1, 2, and 4 stand for. 1 degrees, which would be considered mild, 2 degrees, which would be considered moderate, and 4 degrees, which would be considered vigorous. We do need to be mindful of using the vigorous setting in this particular nursing home type of settings, because it often is a little bit too strong, and we're often going over bonier prominences. And so use your clinical judgment, talk to your CPC about the situation, but the 4 is likely going to be a little too warm by the end of the treatment. We have to consider that the ultrasound does reflect off of bone, so that heating could become too much for that patient. And as you notice, the higher my intensity, the lower my time is, okay? And if you need to change that intensity in the middle of your treatment, the machine will know roughly how much heating has already transpired and be able to adjust your time accordingly to still deliver the same amount of temperature that you had initially chosen. So it's a very smart feature that you have here. It's going to deliver a much more accurate heating to the tissue. So I would highly recommend using the preset modes of the 1, 2, or 4 degrees when you're going to do a thermal application of the modalities. I will point out that you do have the information button here, and you do have a little bit of a tutorial on what you've chosen and how it works, and then a picture library in here as well, giving you some treatment options and ideas. Okay. All right. Lastly, I'm going to move on to do just a quick overview of the combination therapy treatment. So the combination therapy is a little bit more advanced of a treatment, and your CPC can go over this in a lot more detail for you, but I did want to give you a gist of what it's about. You do need that black cable with the red, and you're actually going to use channel B and insert the red tip into channel B's red. And what happens is that red positive is going to be connected to an electrode, and that's going to kind of be a dispersive electrode for you. And then your ultrasound head is going to end up being your second electrode, but you're able to move it, right? So it's kind of a moving electrode, and it's going to be delivering an ultrasonic energy at the same time. So it's a really neat application, lots of really positive outcomes with it. If we go into the indications, you'll notice pain, increased circulation, muscle tone and spasm are some of the indications that we have. Just going into pain to be consistent, okay? If I were doing an acute pain scenario, okay, the machine is automatically guiding you towards the proper ultrasound protocol as well as the E-stim protocol that would be appropriate for acute pain. So we talked about acute pain with the ultrasound being a subthermal application for most of those treatments. And then in our E-stim, we talked about the acute pain being best with your sensory. So the combination here for acute pain is going to be a sensory stimulation with that subthermal ultrasound being delivered through the head. So you still do need the gel over the area that you're treating, but you're able to move that energy around with the ultrasound head, okay? If you do go into the information section, they do a really nice job of walking you through the steps in this initial narrative, okay? And let you know how, what order you're supposed to be increasing them at. And then you do, again, have some possible treatment ideas. This one's showing a post-operative knee situation, hip, low back. So lots of great opportunities there.